Thanks for making time. Welcome to KTN Prime. I'm Jesse Rogers. Millicent Randa is our sign language interpreter. Now, let's begin with our top story tonight. It's an institution entrusted with enforcing discipline, accountability, and rehabilitation. But a KTN investigation has uncovered a trail of documents, internal records, and testimonies that raise troubling questions about the Kenya Prison Service and how it manages public resources and how some of its own employees have been treated. From questionable transfer allowance payments to payroll irregularities and health workers who say they've gone unpaid for more than 16 years, the findings point to a system under growing scrutiny. Our investigative reporter, Haman Kamariki, kickstarts our broadcast tonight.
Every transaction leaves a record, a transfer letter, a payroll entry, a bank instruction, an internal memo. On their own, they may seem routine, but when examined together, they begin to tell a different story. Over the past several months, KTN has reviewed confidential documents, examined payroll records, and spoken to serving officers, affected employees, and insiders familiar with the operations of the Kenya Prison Service. What emerged was a pattern of inconsistencies that raises serious questions about financial accountability, administrative oversight, and the welfare of employees charged with running one of the country's most critical security institutions. Records obtained by KTN show that in 2025, the Kenya Prison Service processed the transfer of 835 officers. Each was listed as eligible for transfer allowance of between 30,000 Kenya shillings and 115,000 Kenya shillings. But as our investigation traced several of those names, the official records and what happened on the ground did not match. Multiple sources and documents reviewed by KTN indicate that some officers listed as transferred never reported to new duty stations. One insider who requested anonymity alleges that some officers received transfer letters only on paper. According to the source, they were later summoned to the department's headquarters, where they were allegedly instructed to surrender the money.
The most synonymous is what is called a transfer allowance. You will find a very, very huge number of money is being siphoned through these transfer allowances. And at one point, it was flagged off by one of the government agencies that Kenya Prisons is paying transfers which were not effected. Like someone is paid for a transfer that he or she did not go. And at the end of the day, the money is sent to you, but you still have to send something back to the headquarters for you to be able to get that money.
They tell you that they know you got some allowances, but you're not supposed to get them. So you are given options. It's either the money be recalled back as overpayment, or you pay something and that allowance goes.
The documents also revealed that officer number 963, identified as Dixon, who was listed as transferred but reportedly continued serving in Kajiado. Officer number 964, identified as Davida, allegedly remained stationed in Kiambu despite appearing on the transfer list. The same pattern is reflected in the case of officer number 944, named Wesley, who reportedly continued serving in Naivasha, and officer number 772, who also remained in Kiambu.
I had to wait for several months for me to get those allowances. And even while you wait for so long, you find some people from the salaries just calling you and telling you you're supposed to pay this amount for us to be able to get you your allowances that you are due to.
KTN is not suggesting that these officers were involved in any wrongdoing. Rather, the investigation highlights apparent discrepancies between official transfer records and the officers' reported duty stations. Documents further indicate that the Kenya Prison Service spent approximately 42 million Kenya shillings on transfer allowance during the 2025 transfer exercise. KTN's investigations also uncovered concerns surrounding the department's payroll system. Sources allege that some salary payments were directed to bank accounts that did not belong to legitimate employees, while other accounts received unusually high salary payments. One letter addressed to Family Bank instructed the bank to suspend salary payments amounting to more than 2.5 million Kenya shillings that had been scheduled for several accounts. The letter states that November 2025 salaries worthy more than 2.5 million Kenya shillings may have been mistakenly or fraudulently diverted to bank accounts that did not belong to the intended beneficiaries. Beyond payroll concerns, KTN's investigation has uncovered a long-standing grievance among healthcare workers serving within Kenya Prison Service. Nurses, clinical officers, and other health professionals claim they have not received several of their allowances, including risk allowances, since 2010. Some of the affected employees say they have repeatedly been promised payment over the years, but those promises have never materialized.
We have had cases of extreme cases of TB, that like multi-drug resistant TB. We have had one case of extra resistant drug TB. We have had cases of hepatitis in our prisons, and these are very, very critical conditions that we manage. And by so doing, we just implore our employer to really look into those allowances that we're looking into, because from history, from the people that have come before us, they have tried to look for these allowances. It is not forthcoming.
Clinical officers, nurses, doctors, and other public health officers and other health cadres. However, even after they raised these advertisements and they recruited, they trained and deployed, they denied them the medical allowances as stipulated by the law.
In one of the recordings obtained by KTN, the Director of Human Resources, Frederick Adeka, is heard assuring employees that their outstanding allowances were being processed.
There were challenges before, but we have a very proactive direct HR, and we are moving forward to ensure that the allowances are paid.
Despite those assurances, a commitment that all outstanding medical allowances would be settled by March 2026 is yet to be fulfilled. Healthcare workers also claim that when they were recruited, official job advertisement indicated they would receive various allowances upon taking up their appointments. They now say those promises have never been honored. In July 2025, an investigation by the Ethics and Anti-Corruption Commission (EACC) also identified payroll irregularities within the Kenya Prison Service. The commission found that some junior officers were allegedly earning salaries equivalent to those of senior directors, while some senior officers were reportedly receiving salaries below the levels prescribed for their respective job grades. EACC attributed the discrepancies to weaknesses in payroll management and inconsistencies in employee records. We reached out to the Kenya Prisons Service for comment on these issues raised in this investigation. Commandant Patrick Karandu confirmed to KTN that the payroll haze happened and his officers was quick to stop further hemorrhage. And on the medical matter, Randu said, and I quote, "We are working with the Salaries Commission to regularize how the money should be paid. It is true, they are owed and they should be paid their allowances. But this is the uniformed force. The way doctors working in public hospitals get their allowances is a bit different from the disciplined force. So we are actively working with the relevant government departments to ensure our doctors get their allowances. They are entitled to it."
Ewe Mwenyezi Mungu unisaidie.
Magereza House, where many expect to be a place of discipline and order, has made health workers go through the mental torture for failure to receive their health risk allowance, despite others from counties and other departments receiving the same. The question remains, will the Ministry of Interior act on making sure that they get their dues and also act to make sure that the money that is lost in Magereza House and the Department of Prisons is recovered, or it's going to be the story as usual? Haman Kamariki, KTN, Nairobi.
Well, thanks, Kamariki. We'll follow up on